Welcome to Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. I'm your host, Kai, and we are so excited to be bringing you expert interviews and member impact stories that highlight the ever-growing community at the Coalition for Hemophilia B, CHB for short, where the mission is to strive to make quality of life the focal point of treatment for people with hemophilia B and their families through education, empowerment, advocacy, and outreach. So today we'll be diving into a topic that hits close to home for so many of you listeners: the importance of community and your mental health when it comes to living with a rare condition such as hemophilia B. As I'm sure you are aware, living with a rare condition can be an incredibly isolating experience, and with few people who truly understand what you're going through, it's easy to feel alone and overwhelmed. So in today's episode, we're going to talk to clinical psychologist Dr. Mina Windriver about the effects of community on our mental health and how to start making those connections through CHB. Welcome to the podcast, Dr. Mina.
Hi, thank you for having me.
Of course, it's wonderful to have you. And I guess I just wanted to kick this off with telling us about your experience with CHB.
Well, I've been part of CHB for many years now. I am just so indebted to them because they provide a lot of really great patient education and advocacy to patients and families with bleeding disorders. So I am a speaker, frequent speaker with them. I do a lot of talks on mental health, behavioral health, women's issues, men's issues. When I see patients what we call womb to the tomb. And so my expertise in seeing children, really tiny kids who are being poked and getting this new diagnosis, all the way to maybe older gentlemen, older women who are suffering from hemophilia B.
Wow. Okay. So you see really the wide spectrum and the wide range of physical and mental effects that this condition can have on somebody.
Right. It can happen at all phases of life.
So I think I wanted to ask you just about the dangers to our mental health when we don't have a sense of belonging, specifically as it concerns living with a rare condition.
When you don't have a sense of belonging, the idea is that a lot of our patients and families experience a lot of social isolation, which can lead to mood disorders, depression, anxiety, feeling like no one cares about them or understands them, just really feeling helpless and hopeless.
Yeah. And helpless and hopeless, and like the things you're saying, like isolation, depression, and even I think like suicidal ideation could even be part of that conversation.
Right, absolutely. That's generally the more the extreme, but it does happen with patients with chronic illnesses. And so it's really important that we catch people, we get our patients and families before that even happens. We don't want families or patients to ever get there. And so that's why it's so important to have a sense of belongingness in this community.
Yeah. So in your expertise, like what are some of those red flags that you see to kind of maybe help a listener maybe flag some of those things as well, that, hey, maybe I need to make some efforts to go reach out and find some community?
Well, a lot of it is more of just like biological bases. So biological bases meaning that like maybe you're sleeping too much. Maybe it's hard to get up in the morning. You just don't want to get out of bed. Maybe you just don't have enough energy. You're apathetic. Like sometimes you get up and you're like, why? Why even bother? Sometimes we overeat or we undereat and we're feeling stressed or depressed. And sometimes as adults too, but we can gain these what we call maladaptive behaviors. So maladaptive behaviors meaning that like we might drink more, we might engage in more cocktails than we should, or might start smoking more to reduce our stress, or we might use illicit drugs that we think is helping us, but really they're just really maladaptive behaviors.
Yeah. So, and I think what I heard in there a little bit was maybe it's this idea of escapism. I'm trying to get out of whatever I'm in. And obviously that's just temporarily. But I guess, so when we're so affected by, maybe bad mental health, what's the consequence of that on our physical health?
So many things. There is a relationship between when we experience anxiety and depression and having increased joint pains or injuries. And so if we're not and if we're agitated, if we're irritated, or if we're feeling depressed, we might fall down more. We might be more clumsy because we're not getting enough sleep. And
Hmm.
so as a result of that, for patients who have bleeding disorders, that could be really detrimental. If you
Yeah.
fall down and hurt yourself, you're going to have this really big bruise or these joint issues, which then leads to physical problems too. So
Hmm.
there's a huge relationship between that and what it does to your body.
Yeah, yeah. So, and I guess, the point of this conversation, the reason we wanted to bring you on is to really drop the science on us, right?
Hmm.
What is happening to our brains when we don't have that sense of belonging in the community, the effect of that on our physical health, all within the context of already living with this disorder. So I guess, what are the benefits then to engaging in community through CHB?
So many. I feel like we don't have enough time to even talk about it
Okay.
all. There's
Yes.
so many, but I mean, I think the most important is, of course, which is the opposite of what we've been talking about, the sense of belongingness, feeling
Sure.
like, hey, I belong to this group. A lot of times, like when we participate in a lot of these programs that the CHB puts on, we meet other patients, we meet other families, and we realize that, like, oh wow, we have a connection. But also, people hold a lot of valuable information too.
Sure.
Another patient might say, "Oh, hey, did you hear about this program for men or for women, or for patients with bleeding disorders?
Mhm.
Education, conferences, symposiums, things like that." That
Like lived experience can then become shared experience.
right, exactly. We're passing on this information that we have, which is so
Mhm.
important, and that's part of the
Yeah.
connection too. Yeah,
Yeah. So I guess when it comes to that shared experience, I guess I'm imagining, there's veterans in the community, and then there are, I don't
yeah.
know if you want to call them newbies or people who are just joining. So
Right.
what's that relationship like, or maybe what should that relationship be like?
Well, I think it can be like, and it can look like many different ways. I mean, again, the thought is just that those who are veterans who've been in the program for a while, who are thriving and doing really well, can make themselves be available to those who are not quite there yet, who don't know anybody in the community, or who feel really shy or inhibited, or feel like, well,
Mhm.
why would I want to join a group like this? And
Yeah.
I talk a lot about with patients too, is that everybody's on a journey. And so whether you're at the very beginning of the journey, in the middle of your journey, or you feel like you're at your advanced journey, there's many ways in where you can go look for help or find help or even provide help for others.
Yeah, so I guess I'm hearing a call to action out there for veteran members of CHB is remember what it was like when you were first joining or when you were first diagnosed. Like, what did that feel like? And you
Right.
can be part of the solution for somebody who's new to the community or who's just been diagnosed. So, really take an active effort. And if you are new to the community, reach out, ask questions, and because I think
Absolutely.
ultimately, Dr. Mina, is we're talking about normalizing the mental health conversation because it doesn't matter who
Absolutely.
you are. You use the word journey. Yes, we are on a mental health journey, and it's not like the journey stops someday. All right, I
Mhm.
figured it
Right.
out.
Right.
Where I think what we're talking about is that journey of discovery, like you're saying. So, I guess when it comes to normalizing mental health, um, if I'm somebody who's just starting that journey or is having a tough time acknowledging certain feelings, like where do you start?
That's a really good question. I would say that the first thing to start and is maybe talking with your own maybe primary care, or even your own hemophilia treatment center to be a really nice starting point. So
Hmm.
whether doctor have your appointments with your physician or your physicians at the hemophilia treatment center, they can work with you on getting connected. That's really the first start because
Yeah,
in your hemophilia treatment center, there's going to be nurses and doctors and social workers, and sometimes there's a psychologist there, and that's a really great start. And we have a
yeah,
load of information too.
yeah.
So we can start providing that to you. And so there's times too that when we provide information to newly diagnosed families and they're just so overwhelmed, they're not there
Hmm.
yet. They're not
Yeah,
there in
right,
their
right.
first step. And then there's some who are like, oh no, I already know. I'm the camp director. Or like,
Yeah,
or oh
sure.
hey, I'm already been involved. So it's
Uh-huh.
like, oh, that's amazing. But yeah, no, I think it's just really starting with your physician and going from there because I think that that's a springboard. And especially if you have been in the community for a while, if you know somebody else, so like if you know um, another person who's in the bleeding disorder community and reaching out to them and they're involved, that's a really great intro as
Yeah.
well. They've already done theirs of that.
Yeah, yeah. The resources are there. Just, we just have to uncover and go
Yeah.
find them.
We just have to
Um,
ask and be okay with that.
just be yeah, just you gotta ask. You gotta ask. Okay, so let's say I'm doing everything right. I joined that community. what are my benchmarks? Like, what am I looking for in terms of like, is this doing what it's supposed to be doing?
Yeah. I would say that no one is going to be able to measure your internal meter. Only you
Hmm.
can do that, right? And so the idea is that being able to think back like 6 months from now or even a year from now and say, hey, what am I doing? How am I feeling? How am I thinking?
Yeah.
What have I been doing? And so
Hmm.
what I might tell a lot of my patients and families is just like do a journal or maybe even doing a family journal and getting your kids involved in that as well.
Yeah.
And then maybe even like write down things like, hey, in 6 months from now, I'd like to be able to join a support group. Or
Hmm.
maybe in a year from now, I'd love to be able to attend a conference
Yeah.
that CHB puts on. And so maybe looking back at that journal and going, oh my gosh, look at that. Look at where we
Right.
first started. I started with like not knowing anybody at all to like now, like I know so many people in the community, or maybe even just like I know one more person and that's it. Or maybe even just I joined a Facebook group where
Hmm.
the CHB is on there. I joined some sort of social media or some sort of group. And that could be just a first start.
Yeah, yeah, absolutely. And again, I'm hearing that idea, this journey. So now we're like, maybe we're mapping out that journey, right?
Hmm.
3 months, 6 month, 1 year, 5 year. Like, what benchmarks can I make for myself that I can measure my involvement against? So
Yeah, no, absolutely. I mean, I go from, I've done a talk for CHB for parents who have young kids, and I go from seed to bloom. So we
okay,
talk about like we're seeding, we're just tending the ground,
yeah,
we're just putting the little seeds into the ground, and we're just gonna see what happens to that. We're gonna watch it bloom, and we go through like this series of like how we're gonna get to where we're gonna bloom, how we're gonna
hmm,
shine, and what do we need for all of that? Like we need water, we need sunshine. But
yeah,
as like we need a community, we need people around us, we need our support system, we need our HTC to help us. So that's just like I said, part of the journey.
yeah, yeah, and that's a beautiful, beautiful analogy there, using the seed to bloom, and
Yeah.
also a children's song. When I used to teach children's music, there's a seed to bloom song that you
Oh
would
my
do.
goodness, that's so fun.
Yeah. So I guess, as we kind of wrap up this conversation, thank you so much for your time and your everything you've done for the CHB community. Um, so I guess I'm really thinking about that person who's listening to this episode. Maybe this is the first thing they're doing. They're
Yeah.
curious about this community, and they're very apprehensive. They're scared. Maybe the diagnosis is new. Maybe the diagnosis is of a very small, family member. So what do you recommend that person do to really take some really safe steps towards joining the CHB community?
I would say that one of the first things that they can do, and like I was saying this earlier, maybe talking with your doctor, because that's a really
Okay.
safe place. Like we all
Yeah.
trust, hopefully we all trust our doctor. That's a really good
Hmm.
place to start.
Okay.
But I often go onto a website too. I might just like Google CHB and I would just say, hey, like what's on this website here? What kind
Hmm.
of programs are there? And there's a way to contact them. I think Rocky will reach out to you. Somebody from the coalition will reach out to you.
Great.
And they're all so friendly. It's so,
Yeah.
so, so friendly and not intimidating whatsoever. So I think if anybody's out there and you're listening to this and you're just curious or you're just wondering or you're um, starting on your journey, or maybe you're even a veteran too, is just reach out and we're
Yeah.
here to support. We're here to
Yeah.
help you. We really want to do that. That's what we're here. That's what
Yeah.
this is what our passion is. And we're
Uh-huh.
not going to stop doing that until we're done, until this
Yeah.
disease is cured.
Yeah, yeah. I appreciate that so much. And I can attest, I have had the pleasure of meeting some of the folks you've been mentioning, and passion, kindness, authenticity are the characteristics that just
Absolutely.
shine through. So if you are afraid of taking that step, just do whatever you can to make that first email or make that phone call. CHB is here for you. So that wraps it up. Dr. Mina, this has been Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. For more information on upcoming CHB community events, just go to www.hemob.org and click on Get Involved and then Upcoming Events. And thank you to our guest, Dr. Mina.
Thank you so much for having me. Appreciate it.
Of course. And until next time, everybody, take care. This episode of Boundless B, the Hemophilia B podcast, presented by the Coalition for Hemophilia B, is made possible in part by the support of CSL. We thank CSL for their continued commitment to the bleeding disorders community. This episode of Boundless B, the Hemophilia B podcast, presented by the Coalition for Hemophilia B, is made possible in part by the support of CSL. We thank CSL for their continued commitment to the bleeding disorders community.